Health is important. My health, your health, the health of our families, the health of our friends. When somebody falls sick, it becomes a priority. Everything else becomes secondary. A child with fever in a household, a father with uncontrolled blood pressure, a mother who is diabetic and now has clinical depression. These are very important priorities for us. We put everything aside to pay attention to these problems. Like household, societies and countries also have problems of sickness and unwell populations. So what is the state of health of people of Pakistan, the household, our collective household we call beloved Pakistan? But let me take a pause and also share with you what do we really mean by health as a state, as a condition, as a concept. So I would like to take you to the late 1940s, when after Second World War, the people of the world decided to establish United Nations and a special agency within United Nations which was responsible for health. They called it World Health Organization. They put the people together to draw the first constitution of the World Health Organization, and the task before them was very hard. Define health. What is health? It was a complex task. It was a difficult journey, and there were diversity of issues from across the world. But after passing through a lot of complication, difficult discussions, people did agree on the concept and on the definition of health, which is as follows. They defined that health is a state of complete physical, mental, and social well-being, and it is not mere absence of disease or infirmity. This is a very important conceptualization of health. And why I decided to share this with you, because everything else, every healthcare system, every intervention to improve health will be based upon this definition and understanding of health. So now let me turn to what is the state of health of the household that we live in, our Pakistan. Like in any household, when the children and the mothers and the women of the family fall sick, they become the greatest priority. So what is the state of our children? I will just share few indicators with you for lack of time, just to give you a feeling that where we stand. So 40% of our children in Pakistan have stunted growth. What is stunting? It is physical, it is mental, and if it is not reversed in the first 1,000 days of the life of the child, it will become irreversible for the rest of the life. What does it mean? It means that these children with weaker mental capacity, with weaker physical bodies, will be spending the rest of their lives at a low threshold. They will not be productive enough for the economies, they will be slow to learn skills, and they will be slow in every path of life. 40% of them. What is the status of immunization of children? The best estimate in Pakistan is that around about 75% of the children are being immunized. In other words, quarter of the children in Pakistan are not being immunized for very cheap vaccines which can protect our children from more than 10 very common and very lethal diseases. And this 75%, ladies and gentlemen, also have to be understood because it's a national average. If we go deeper, the children in Islamabad and children in Punjab may be 90% immunized or up to 90% immunized, but children in Balochistan will be immunized up to only 40%. If we go further deeper, the children in the district of Pishin, Bolan and North Waziristan will be only immunized up to 20%. 80% of our own children in the household of Pakistan are not being immunized and not being protected. Not a rocket science anymore, but we are ignoring it. Our women, 43% of them in the reproductive age are suffering from iron deficiency anemia. A very simple intervention will improve their lives. If we talk about communicable diseases, currently Pakistan has one of the highest prevalence of hepatitis C. Every 20th Pakistani is suffering from hepatitis C. If we talk about polio, another communicable disease, there are 194 members of the United Nations, and there are only 2 countries who have failed to eradicate polio from their countries, Pakistan and Afghanistan. If we talk about non-communicable diseases, every 4th adult above the age of 20 years is now type 2 diabetic. Every 3rd adult in Pakistan above the age of 45 years is suffering from raised blood pressure. Every 4th mother who goes through childbirth also goes through perinatal depression, which to large extent remain unaddressed. Every 5th child, school-going child, has some kind of emotional or behavioral problem. And these are those lucky children which actually end up in schools. We also have a population, a largest population of children who are out of school. So what does it all mean? It means lower life expectancy. The aggregate effect of this whole situation is low life expectancy. Our average life expectancy in Pakistan is around about 68 years. What does it mean? Let me bring a perspective to it. A person born in Hong Kong has a probability of living for 85 years. We have not been able to control our population. We have highest rate of population growth rate in Pakistan, 2.5, highest in Asia, one of the highest in Asia and in the region. Our total fertility rate, that is how many children a woman in reproductive age will bear, 3.6, one of the highest in Muslim countries, even more than Saudi Arabia. So where we go from here? This is the kind of public health crisis that we have created by disorganizing and misorganizing and mismanaging the health of the people of Pakistan, but not paying attention to their real needs. All these diseases, all these conditions that I have mentioned to you are first and foremost preventable. And if not preventable, they can be diagnosed. If diagnosed early, they are almost 99% treatable. We are failing our people, but not doing so. There are countries who have done it very successfully and have moved on. So, what are the options and can we do this? Absolutely we can do this if we put our house in order. There are 5 things that we need to do. Number 1, first of all, we need to make a change here, a mindset. What kind of health system we have created in Pakistan, where we are not doing the easy things to do closer to the people at primary health care level in terms of preventing these diseases and making life easier for the people and for their rest of their lives. But we are paying more and more attention to tertiary level health care in big hospitals. In private sector, it is understandable, but why the government would do that? We are one of the lowest spenders in health in Pakistan, in the world. Pakistan spends less than 1% of its GDP and 70% of it goes into tertiary health care. Only 30% is going in the primary health care. So, first of all, we need to decide in our minds that where are our priorities and why our people are not our priorities and why we do not want to make life easier and healthier for them. Second, we have to implement universal health coverage for every Pakistani. What does it mean? It is not just words. It means that minimum package of most important, most essential, high priority package of health services which consist of preventive, promotive, curative, rehabilitative and palliative health services must be delivered to the people at their doorsteps. And those who go to the private sector and do not have affordability, we need to provide them financial protection. We have worked out these services. We have developed a financial protection program in the form of Sehat Sahulat program. This Sehat Sahulat program needs to be limited to only those who cannot afford and not for the rich people. And it needs to be expanded to the primary health care. We are not providing it in the primary health care, we are only providing this financial protection at the tertiary level health care. It also means that we need to bring into focus the strengthening of our primary health care, our BHUs, our RHCs, our lady health workers, enabling them, giving them the right skills, giving them the right education and training to deliver this package of services. Fourth, we need to also protect our people against the risks to health. Diseases, if not protected, if not prevented, absolutely cause a lot of misery. But why diseases develop in the first place? There are a number of risk factors which are outside the health sector. Unsafe drinking water, polluted air, and the list goes on. These are those risks which make us vulnerable, which weaken our health and make us prone to develop these diseases. There are two kinds of risks, environmental risks and behavioral risks. Environmental risks are those which are not in our control, but which are around us. Polluted air. Lahore is now the pollutest city in the world. The pollution across the country is also very high. This creates a number of diseases. Behavioral risks are those which are in our control. Two examples. Smoking kills. We still have very high prevalence of smoking among adults in Pakistan. Sedentary lifestyle is not helpful. It causes a number of non-communicable diseases, lack of exercise. This is in our control. So, the family medicine and the lifestyle medicine are the keys for the future if we really want to improve the health of the people in Pakistan. And last but not the least, health is too important ladies and gentlemen, to be left to the government. We all need to play our role as individuals, as families, as communities, as social circles. Because if we leave it to the government, they will never be able to provide universal health coverage. What does it mean then? It means that we need to have a wide-ranging, well-thought-out public-private partnerships in Pakistan for healthcare, without which we will not be able to improve health conditions in Pakistan. And within public-private partnerships, the commercial health sector, we can leave it alone for a minute, because it is in its own lure. It's like an industry like any other industry. The bottom lines they have to serve. They have to make profits. They have to serve their shareholders. But not-for-profit private sector is a sector that we can attach a lot of hope with. If we, as not-for-profit private sector, join hands with the government, I think tide can be turned. People of Pakistan and the leaders of Pakistan, when they decided that they wanted to make a nuclear bomb, we were also poor at that time. Our economy was also not doing very well at that time. But we made a resolve. We are the only country in Muslim world to have nuclear bomb today. It is just a matter of deciding that do we want to serve our people with essential health care at primary health care level. This is not like making a nuclear bomb. The day we will decide this, we will do this. Thank you very much.